Welcome back. In this episode, we're going to be learning about guiding children's health. A child's health is a key concern when planning, preparing, and maintaining a classroom environment. A healthful environment for young children starts with sound health practices. To avoid the transmission of diseases, stress personal hygiene, and safe food handling practices. Plan for emergencies such as a control of head lice. Also, plan for sudden illnesses and obtain knowledge and skills to provide first aid treatment. So join me, Ms. Trott, as we learn all about guiding children's health. It is your responsibility to protect, maintain, and improve children's health. Thus, you'll need to create a healthful environment. The following objectives should be considered. Develop a center health policy, review children's health records, recognize ill children, isolate ill children, contact parents on health issues, plan a safe environment, provide first aid treatment, and include health in the curriculum.
It is important for your center to have health policies. These policies will help you make conscious decisions regarding the health of children in your care. Alabama's health policy and regulations are laid out in the DHR Minimum Standards for Daycare and Nighttime Center Policy and Procedures Manual. These rules and regulations address only the basic health requirements. Your center may have additional health policies that are more specific.
To protect all children, each child attending the center must have immunizations. The only exception to this policy is when a child is exempted by state law for religious or medical reasons. Centers need a policy stating when an ill child should be at home. Parents should be advised to keep a child home for 24 hours after a fever subsides. Likewise, children should remain home until they have been free of diarrhea for 24 hours. To protect staff and children in their care against lawsuits, most centers have policies for medication. Medicine needs to be brought in by an adult in an original bottle with instructional label. The medicine needs to be labeled with the child's name and stored properly in a secure location. Always give caution when giving medication. If you have any questions, call the parent or prescribing doctor before giving the medicine. To protect children's health, conduct an informal health inspection each day. This should happen as soon as the children arrive to school, and you are observing the children from head to foot for symptoms of ill health. Continue to observe children throughout the day, and if a child appears to be sick, contact the parents. Personal hygiene is an important component of a healthful environment. When cleanliness is stressed, fewer children and staff become ill. Environment control is important to prevent the transmission of diseases. Sanitary practices can remove bacteria and dirt. Policy should be written to include cleaning, sanitizing, and disinfecting. Procedures should address hand washing, diapering, toileting, cleaning, and disinfecting. Hand washing is one of the most important sanitary procedures. Modeling hand washing teaches children the techniques, and its importance shows when children should wash their hands. Young children should never be provided with hand sanitizer. They are not as effective as soap and water and can be harmful if swallowed. Have children use liquid soap and rub their hands under water for 20 seconds. To maintain a healthy environment, you will need to recognize head lice. Head lice can spread through close, head-to-head contact. If one child has it, the other children and staff may get it too. Notices will be sent home to all parents if even only one child has been infected. The infected people should be instructed to seek medical help, and all family members should be treated. In every preschool, injuries and illnesses occur. Sometimes it might be a scratch or a bump on the knee. At other times, it may be a sudden high temperature. First aid is immediate treatment given for injuries and illnesses, including those that are life-threatening. First aid training provides the knowledge and skills needed to handle emergency medical care. Alabama's minimum standards for daycare and nighttime centers dictates how many people on staff need to be CPR and first aid certified. However, for your own interest, you will want to be certified even if the center has met the minimum requirement of staff. If you are not already certified, you will become certified prior to your child development practicum class here at Wallace. To administer first aid, you will need some basic supplies. Store all first aid items in one area and out of reach of children, but not in a locked cabinet, because in an emergency, you may not have time to search for a key.
Some first aid care you might be providing come from
Closed wounds, open wounds, burns, splinters, and insect stings. While choking can occur among people of all ages, children are at the highest risk. The best way to prevent choking is to protect children from choking hazards. Avoid toys with small parts, avoid foods that can be choking hazards, and have children sit while eating. If choking occurs, all staff must respond quickly and know proper procedures for handling the situation. An ill child may vomit, develop diarrhea, or develop a fever. Whenever a child becomes ill, they should be moved into a separate area away from other children immediately, and parents should be informed. Workers need to know how to handle these signs of illnesses while waiting for parents to arrive. If a child with special physical conditions is enrolling in the program, you will need to make plans for this child's health and well-being. Begin by discussing the child's condition with the parents and find out what approach the center needs to take to ensure the child's health and well-being. You will likely encounter several common health concerns such as allergies, asthma, diabetes, and epilepsy. Now let's review what we learned. Children's health can be protected, maintained, and improved in many ways during each day at the center. This is an important part of the teacher's job. The best way to guiding children's health is by setting health policies. Policies might include requiring all children enrolled to have medical exams and immunizations. Contacting parents about health-related issues should also be addressed in your health policy. The second step in guiding health is having knowledge of various illnesses and diseases. You will need to know how to control transmittable diseases and illnesses. Keeping the center sanitary is one important aspect of controlling the spread of the disease. You should also know what steps you need to take in caring for children who are injured or become ill while at the center. Protecting, maintaining, and even improving health is a major responsibility of a teacher. The teacher is trusted with the well-being of the children. That wraps us up for this episode. You can also learn more about this topic by review. If you have any questions, please contact me or your instructor. Thanks for joining me, Miss Trott, as we learned all about guiding children's health. See you next time.